Thinking about education, however you get your education, you have to have the ability to navigate the health care system. And perhaps the most important thing about navigating the health care system is you have to know when to engage it. You could live across the street from the Mayo Clinic in Minnesota, but if you didn't engage the health care system when you had a lump or a rash or a fever or some other malady, you may as well be living in Timbuktu, 1,000 miles away from anything related to medicine. So you have to initiate, and then once you initiate, you have to understand what's going on. And on your side of the fence, from the clinician side, you have to be able to take the knowledge that you have and turn it into something that can be understood by someone of all educational levels that you're dealing with. The other part is insurance and income, and that translates to the ability to get to and to pay for medical advice and treatment. If you're absolutely dirt poor, you don't have a car, you can't walk to the nearest medical facility, especially if you're in rural Arkansas, or if you even have a car, you can't afford the gas to get there. And then once you get there, you don't have the ability to pay, and except for emergency stabilization processes that are required by law to be provided by hospitals, you don't have access to the medical system in any meaningful way. And then even if you have resources, education, you still need to have access to the infrastructure, and how far are you away? How convenient is it for you to get there? And you'll realize also that in Arkansas we have some places that are pretty distant from medical facilities. Age and gender is also a factor. Age is also a big factor for cancer because the older you get, the higher the rates for the age-specific rates. But also as you get older, the frame becomes more frail. You may be losing some of your cognitive abilities, and sometimes it's just not worth the trip to get in the car and then be wheeled around in this medical center or any other medical center in a wheelchair for all day, and it's exhausting and terribly trying and taxing. So that could be a process that prevents you from seeking medical care. The other part is gender. Men tend to put things off as far as screening in particular, where women tend to do a better job of that, so there is a differential there to be concerned about. With race, especially when you're looking at the black population, we have decades of evidence and experience of poor treatment of the black members of our communities. And it certainly is understandable how there could be an ongoing mistrust of coming into the medical establishment for screening or treatment, especially among blacks who are past the age of 40. So all of these things put together represent hurdles or barriers to seeking out screening, preventive services, and also early treatment. And when that happens, then that turns into a health disparity. And a health disparity is where you have a poorer outcome than the best and the optimal outcome. And on a population basis, whether it's black, Hispanic, poor white, someone rural versus urban, those are health disparities that we really want to try to do something about with public health, also with your help. So look at this.